Hello, welcome to this narrated PowerPoint, which is a presentation on clinical evaluation. It has a threefold purpose. Number one, it offers a framework for clinical instructors to evaluate their students. Number two, it provides the nursing student with a comprehensive overview of the work of nursing. And number three, it's a review of the work of nursing for practicing nurses to refresh and improve their practice. Hi, my name is Pat Clay. I have a Master's of Science in Nursing. I'm a certified pediatric nurse and hold a wound ostomy nursing certificate from the WOCNCB. I was a clinical instructor for about 10 years in a pediatric acute care facility. This presentation places the work of nursing into a framework. It's how I work as a practicing nurse and what I expect of my students as a clinical instructor. The work of a nurse is twofold with clinical and professional skills. Clinical skills get much attention. However, the professional skills permeate the profession, offering the greatest opportunities for success and satisfaction. Clinical skills to evaluate include gathering data, analysis of the data, prioritizing care, planning care, performing care. I will describe each of these in detail. Professional skills include patient-centered care, communication with patient, communication with care providers and nursing staff that include coordination of care and collaboration, knowledge base, use of evidence-based practice, self-reflection and evaluation, resource utilization, maintaining safe practice, and leadership. Each of these will be described in detail later. First, let's look at clinical skills. For the clinical instructor, this section on clinical skills evaluation offers a framework for evaluation. For the student, the true work of nursing is emphasized in this section. The practicing nurse may gain fresh insight to improve practice. The first step in the work of nursing is to get to know your patient. For clinical instructors, this method of chart review can focus efforts for you and your students. For a student, reviewing the electronic medical record on a patient you're not familiar with can be overwhelming. Knowing where to get the most information with fewest clicks is a treasure. For a practicing nurse, this is a great way to review your patient's latest information quickly so you can get on with the day. Most recent care provider progress note will summarize patient problems, progress, and plan. Assessment and plan have the most valuable information on that progress note. Look for labs that are not within normal range. Look at all culture results within the last week. As the data is gathered, analysis occurs. Connections are made. The medical diagnosis is based on diagnostic criteria. Here the example is diabetes. Starting with diagnostic criteria will guide data collection. The clinical instructor can use the diagnostic criteria to make broader connections for the student. For example, diabetes is conceptually altered glucose regulation. Searching for and emphasizing the broader concept fosters the student's knowledge base. For the student, diagnostic criteria brings the data into focus, guiding ongoing assessments. If the student creates a concept map or mind map reflecting their thought process, the clinical instructor gains insight into the student's level of critical thinking skills. Not stopping there, but continuing on to connect diagnostic criteria to assessments is crucial for integrating knowledge and experience, as in Benner's theory of novice to expert. The care plan relates directly to problems generated by diagnostic criteria and goal attainment. For the established clinician, knowing the diagnostic criteria focuses monitoring to validate effective treatment plan as goals are met. As the student develops a plan of care, the clinical instructor can see the student's ability to connect the data elements and translate them into nursing actions and prioritizing care. Practicing nurses consider care plan elements that inform their care and chart progress toward the goals every shift. For the clinical instructor to evaluate the student's skills and judgment in performing care, Direct observation is best augmented by feedback from other healthcare staff, not only nurses, but care assistants as well. Does the student introduce themselves and let the patient know the plan of care for the day? Does the student allow for patient input and discussion about how the day is to unfold? Is the student organized, evidenced by medication administration on time and documentation of vital signs? One area of discomfort for students is initiating a conversation with the care provider and other care provider team members, perhaps on rounds. Is the student armed with the latest lab results and how the patient is responding to care? Are there any questions about the vital signs? Does the student participate in rounds, or does the student hide? Yes, hide, when the care provider team is rounding on their patient. Even if the student does not contribute to the conversation during rounds, it is an invaluable experience and an important element of patient-centered care and the nurse's work of advocacy. I recall one incident where I encouraged a student to participate in rounds, and as I stood there with her, I nudged her when they were discussing the baby's vital signs. This was a baby, 3-day-old baby that was admitted with a viral illness. The student noticed increasing heart rate over the 6 hours that she had taken care of the patient. There was tachycardia that was increasing, and she let the team know. The doctor said, well, we'll revisit that this afternoon after we're done with rounds. Well, the next day, the student came back for her second day of clinical and couldn't find her patient on the list. The doctor, who was in the pre-conference room, looked up from his charting and said, oh, that baby died. The student turned white as a sheet. We all were very shocked. So the rest of the day was spent with, you did the right thing. I don't think there was anything you could have done more. You did bring it up and report. The physician made the judgment call, and maybe there wasn't anything that could have saved this baby anyway from the virus attacking the heart muscle. But it was a very difficult day. We did invite the doctor back at lunch to talk about how he deals with death and dying. At any time during the shift, can the student describe progress made toward the care plan and goals? And if necessary, can they describe necessary changes to meet the goals? Okay, let's move on to professional skills evaluation. Always, nursing should practice patient-centered care and advocate for that model of care to all care team members. Is the patient and/or their family invited to engage in care in both the decisions and providing the care to the extent that they need to or want to? Is the student advocating for the patient? Some examples include, if the patient refuses to eat because they don't like the food, has the student communicated that to the dietitian? If there is a concern expressed by the family about mobility upon discharge to home, has the student brought that forward to the care provider team at rounds? Always, the nurse will find themselves the recipient of information from different team members, a receptacle of knowledge that may have to be shared with other team members and certainly passed on in shift report. An example would be that the physical therapist might pass on to the nurse that the patient will need a wheelchair for home. That will require a care provider order. The lab may call the nurse with a critical lab result that needs to be emergently shared with the care provider. The student or nurse may have to coordinate care, as the patient may need wound care between physical therapy sessions and meals. If a wound is discovered, does nutrition know that the patient may need a dietary supplement to promote healing? As a clinical instructor, you rely on direct observation or feedback on the student's communication style. Does the student listen attentively, and is that reflected in their care? Do they follow guidelines on reporting to the attending nurse? Is their manner respectful and friendly with eye contact and nonverbal actions that are inviting and attentive? A major part of the work of nursing is health promotion. Has a student identified an area to teach the patient about restoring, maintaining, or improving their health? What is the plan? And it does not have to be elaborate. What is the plan to share knowledge about the patient that can be beneficial to them? This might be in the area of nutrition, as they encourage a patient to eat 5 fruits and vegetables a day, or managing anxiety with a simple controlled breathing exercise. Sometimes errors occur, or outcomes are less than expected. We all hope for a flawless day, but accidents happen and are not in the plan. Perhaps identifying and thinking through any area of greatest potential for error will promote safe care. For example, I know I will be administering insulin based on a blood glucose reading. Have I looked at the last 24 hours of blood glucoses to identify a pattern that could relate to the administration of the insulin? What if I have a high potassium level taken from a finger stick or venipuncture? I need to know that because treating an inaccurate potassium level could lead to harm if it was run by the blood that was hemolyzed. The incident reporting system is critically important for improving systems. Use it. Students will usually need a great deal of support if they are responsible for an error. Frame it as a system issue with an emphasis on prevention. We've talked about coordination of care and how important the nurse's role is in planning the patient's care throughout the shift and beyond. Our example was the coordination of wound care with physical therapy. When would the best time be for the wound care team to provide the care, if pain medication is required for the care, and if they have a PT session 2 times a day? Collaboration is more than coordinating care in that discussion, and joint decisions are made. From our previous example, coordinating wound care around the physical therapy schedule requires collaboration or discussion with the wound care team and the physical therapist for best outcomes. We don't want a patient to miss lunch that would provide critical nutrition for wound healing, or have a therapy session missed because that was the only time the wound care team had available to do the care. Perhaps the care could be arranged in the early morning before breakfast or after a scheduled pain med that would have been given anyway, eliminating additional pain meds that would interfere with performance during physical therapy. Is a student using resources that are available in the clinical area to build their knowledge base? What does the nurse do if they're unfamiliar with a diagnosis? There should be internet access, but also intranet is an important source for information. Does the student demonstrate how to search for reliable web information? Chronic illness associations such as the American Heart Association and the Epilepsy Foundation will provide important information in formats for both professionals and consumers. .gov sites such as the Agency for Healthcare Research and Quality, AHRQ, the Center for Disease Control, CDC, and the Food and Drug Administration, FDA, provide valuable information that is easily accessed and educational. YouTube can even provide information if it's vetted for accuracy and appropriateness. Make sure the student can look up drug information on the available lexicon tool and use a drug compatibility chart for IV preparations. As a clinical instructor, you might be able to set up informal learning sessions over lunch with a dietitian, a discharge planner, or social worker, or other healthcare professionals. Is the student engaging in all aspects of the assigned patient's care? Is the attending RN available to the student and taking on the mentoring role? I know as a staff nurse, it's not easy to have a student assigned to you almost every shift. It can be distracting. It doesn't ease that burden to consider your own studenthood or to think about the future of nursing that the student reflects. There are many different personalities in the work environment, and learning how to manage difficult personalities and relationships is important to professional development. Helping a student to navigate a less than friendly reception is just as important as technical skills. How can nursing staff be motivated to be enthusiastic about having a student? Well, in my experience, it is that if you have an actively engaged student, that can motivate a less than enthusiastic nurse. Who can refuse an extra pair of hands during a busy shift? It is most helpful for the clinical instructor to provide the nursing staff with a rundown on what the goals for the student are for the shift, and to provide them with a schedule of what you, as the clinical instructor, will be doing with the student and what the nurse can do with the student. We all know there are just some staff who would prefer to not assign students to. It's helpful to foster a relationship with staff built on trust. I mentioned Benner's novice to expert theory before. Keep in mind that knowledge couples with experience to produce intuitive practice. For example, I know about respiratory failure, and I saw that my patient that was admitted with pneumonia was exhibiting a decreased level of alertness. Knowing that respiratory failure is inefficient exchange in the lungs of CO2 for oxygen, what is needed to validate my hunch that my patient may be headed toward respiratory failure? Well, do I grab the saturation monitor? And how do I check for increasing CO2 retention? Is this a call to the care provider to report concerns? These are wonderful opportunities. Step aside and let the bedside nurse take over and talk the student nurse through her actions in response to prevent a worsening of the situation. Allowing the student to summarize the event in post-conference allows them to assimilate the moment and show how their knowledge base is coupling with experience. Oh, the things we remember from nursing school. Knowing the medical treatment for a certain medical condition is important, but the work of nursing calls for treating the human response to that medical condition. Is the student fully carrying out nursing interventions, or does the extent of care stop at the care provider orders? Meeting the nursing standards of care is the heart of the work of a nurse. Yes, we follow medical orders, but also nursing orders that fill in the blanks and between the lines to plump out the patient-centered care model. We learn the standard of nursing care from books, but see the results when they are implemented at the bedside. Nursing interventions are created and evaluated through research. There are levels of evidence ranging from the least trustworthy opinion based on personal experience to the most trusted randomized controlled trial. This is an example of an evidence-based practice exercise. This is a project for 2 or 3 students that can be accomplished during a clinical day if an hour or 2 of dedicated time using hospital or clinic resources is provided. Sometimes a student has a patient that does not require as much care during the shift. This is an excellent project that will teach the student about reliable informative web resources as well as stimulating discussion with nursing staff. They love to have the students ask them tough questions. Consider a burning question such as, should I restart an IV when the patient says it burns at the site? In addition to a web of research, hospital resources should be utilized, such as the vascular access team, and perhaps the pharmacy if the pain occurs in relation to an infusion. It might be a dilution issue or related to the rate of the administration of the drug. Self-evaluation is a critical step in awareness that can lead to growth and change. Student paperwork should be complete and neat. Direct observation by the clinical instructor is important, from which valuable information can be gleaned not just about the student, but about the culture of the unit. Formal feedback from staff on a communication form of some kind is necessary, as a clinical instructor cannot be everywhere all the time. Informal feedback is just as important. Perhaps a walk around after the students have left might provide information that you might not otherwise get due to time constraints or hesitancy to speak out. Don't forget to interview the care assistants or other relevant staff that have had interactions with the students. Look for any pattern to the feedback. Address concerns as soon as possible with the student in a private place. Don't be afraid to address a needed attitude adjustment or to assign remedial work. Frame any conversation with the student in a way to show caring concern and let them know criticism provides opportunity for improvement. It's always good to remember that schools are producing at minimum an entry-level generalist. There is so much learning that takes place after graduation on the job. Most importantly, the student must not be afraid to ask questions or intimidated by any staff of which the result may be not speaking up to prevent harm or in reporting an error. Creating a professional, engaging, and nurturing climate for the student nurse is necessary for the best nurse-sensitive outcomes and job satisfaction. The final evaluation should culminate in a recognition of areas to work on as the student goes to the next rotation. For example, if the student has consistently fallen short in getting vital signs charted on time, a plan can be drafted going forward to the next rotation. It's not likely to resolve without effort. Resource utilization. This was discussed earlier in this presentation. Here is a list of resources a student can reach out to for general information or specific regarding their patients if the service was consulted and there is a note on the chart. Try to contact the staff member that was charted on the patient and knows them. Students are usually shy to make a call, so be with them, and they should always discuss any intended contact with an ancillary service with the attending nurse first. For example, if the patient has a question about a med you cannot answer, then ask the pharmacist to talk to them. If there are supply needs for homes, such as dressings or a wheelchair, contact the discharge planner. If the patient is bored or needs distraction, contact the activity coordinator. Social services can mobilize community resources, such as transportation or voucher needs. An earlier example was consulting nutrition about a wound that might need dietary supplementation, such as a protein drink. This is truly the collaborative work of a nurse. The patient safety goals formulated by the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, offers a set of best practices to keep patients safe. Here are the 2021 safety goals for hospitals. For the clinical instructor directly observing the student will verify that they are using 2 identifiers each and every time they render care to their patient. If the student has an observation shift in surgery, they can observe the timeout procedure that verifies the patient and the right site for surgery. Most facilities have a fall risk form to identify patients that have potential to fall. The clinical instructor's job is to make sure the students have knowledge of and experience with these important tools for safe practice and preventing harm to patients. Prioritizing and delegating care. Prioritizing care is important to prevent failure to rescue and for best outcomes. Delegating care can be learned as the student realizes what only the RN can do that no one else can, and then delegating those things that the care assistant can do. The syllabus must be clear and establish specific rules regarding the scope of practice for the student. The clinical instructor must ensure that the staff know what the student can do, and the student must speak up if asked to do something outside of their scope as a nursing student. Leadership can occur at any level of work in any profession or job. The first step and important element of leadership is the ability to paint a vision for oneself and others. You've probably heard the saying, without a vision the people perish. Oh, how true that is. A vision provides hope that is attainable by having clear goals. The next component of leadership. Goals bring the vision to reality. Goals offer substance to the vision if they are clearly stated. And the SMART acronym helps a person to create goals that are specific, measurable, achievable, relevant, and time-based. An example for a student might be to take a manual blood pressure cuff on 5 different patients during their clinical shift. For an instructor, a SMART goal may be to complete evaluations for 3 students by noon and 3 additional students by 4 p.m. A critical component of leadership is courage. Courage is needed to stand up for injustices, to advocate for patients, to challenge the status quo with reliable research. Courage should not be blind, but be undergirded by integrity and moral courage. A clinical instructor must have the courage to speak the truth in love to a student, to draw attention to areas that need improvement, but with an attitude of caring for that student. People are motivated by different things. It's important for a clinical instructor, as they get to know their students, to learn why a student chose nursing, the student's vision, and then to help them find the path to the fulfillment of that vision. Leadership skills can also be taught to a patient so they can be their own advocate first and hold their care providers accountable. Even a hospice patient can wish for a peaceful death and with family around. Any wish can become a vision with goals that make it a reality. In summary, a fair evaluation of a student's work must have a degree of direct observation. Engaging with the student a few times during the clinical shift provides a broader picture of their skills and abilities. I always told my students to hang out in the room and not enter, get the task done, and exit quickly, but to hang out charting or straightening up the room. This is time well spent to get a feel for the vibes in the room, so to speak, to observe relationships between patient and family, or learn about how the patient interacts with the environment. This is especially true for infants and children and elderly who are so very dependent on family and staff and have no way to interpret or to speak to problems they might be experiencing. Hanging out provides the nonverbal clues that contribute to the whole picture. Getting feedback from staff the student has worked with during the clinical shift is very important. This can be a formal communication form or informal, how did it go with the student today? Always look for patterns in feedback, integrating it into the bigger picture, weighting it appropriately. Expectations for students must be clear from the start. If they are to chart all vital signs and then don't, that's falling short of an expectation and needs to be addressed. Formative evaluations are so important to address unmet expectations, to ensure the student is clear on expectations, and to identify any barriers to meeting the expectation, and to make a plan to meet the expectation. So important to a final evaluation is to send the student to the next rotation with a clear idea of what they need to work on to be successful. I would ask the students at our last post-conference, what is the one thing you learned from this rotation that you'll take with you to the next rotation? It was surprising to me sometimes that they would mention as most meaningful. I will never forget what one student said in response to this question after the pediatric clinicals in a large acute care facility where you see the worst of the worst cases. When I asked the group, what will you take with you from this rotation? He spoke up and said, a vasectomy. We all laughed, but then we proceeded to remind them that they see the worst cases in a center like this and that most children are healthy and are visibly participating in the community. This led to a discussion about community support for complex children with ongoing health issues. It was a very productive end to a trying rotation. I hope you enjoyed this presentation. You can find more narrated PowerPoints for nursing students and instructors on my YouTube channel, Prof. Clay A+ Clinicals. You can also email me at profclay2020@gmail.com, and thanks for watching.